Dr. Jessica Garrett from the Birmingham Maple Clinic to talk more about ADHD. And so, with that, Dr. Garrett, great to have you with us.
Thank you. Good morning. Thanks for having me.
So, I've been wondering about some of the kids right now and the lasting impact that this pandemic is going to have on them. Have you been seeing and treating more people because of the pandemic for ADHD?
Definitely. Definitely. We've seen a huge increase in referrals just in general. But as far as evaluations go, and for ADHD specifically, we've, noticed a huge uptick in that. Absolutely.
So, for those, if we can kind of just backstep a little bit, what is the clinical definition of ADHD?
So the clinical definition is there's three types of ADHD, and it's all ADHD now. It used to be there was ADD, but now ADD is ADHD inattentive type. So we have ADHD inattentive type, and that's just, lack of focus, difficulty concentrating, easily distracted. And in children, and especially in girls, this is oftentimes overlooked because these are more of like your daydreamers. Their behavior is not really acting out; they're just kind of lost within themselves. The other type is the hyperactive and impulsive type, and those are the ones that stand out and tend to get noticed right away. So, constantly getting up, talking a lot, interrupting others, difficulty with impulse control. That's what that kind looks like. And then the third type is where we have a combination of the two, inattentive and hyperactive and impulsive.
Yeah, I always think scatterbrains, right?
Yeah, that'd be accurate.
So, with that, what signs should a parent look for, and when do they know to get help,
Yeah.
and or is it just like a mild case if there is such a thing?
Yeah, there's definitely such a thing as a mild case. And I think we've seen a big increase in, evaluation requests because parents are seeing their child, Zoom from home, and they're like, whoa, this is really difficult for them. So I think when parents need to look for help is when their child is really struggling. I've had parents bring their children in for assessments where the child was the one who said, I need some help. So when parents see their child struggling, when they notice that maybe they're different than their peers, that they're having more of a difficult time focusing, then it's always a good idea to bring them in to see if it, actually is a diagnosable condition.
So, with that, if someone is diagnosed, what is the treatment?
Yeah, so treatment looks different for everyone, but some general treatment recommendations that we always discuss are, medication is one option. Um, and there is, some proven medication that works for the treatment of ADHD. Psychostimulants are usually the first form of that. And then also just behavioral therapy. And then structuring their environment, right? So, and that's what's been difficult with the pandemic is, and I think why we've seen this huge uptick is between adults and children, you kind of had these natural boundaries in place. When you were at work or when you were at home, you went to your desk and you were at work and you were able to focus, where, all of a sudden these boundaries were kind of taken away. So without those natural boundaries in place, it's been difficult for a lot of people. So with environmental issues, we're looking at just, making your environment as organized as possible, as structured as possible, as routine as possible, for children and adults with ADHD. That can be, a huge help. So, and then in combination with parent management training for children, helping the parents kind of manage, what their child is capable of and just helping them, be as successful as they can.
So, if this is something that has become somewhat of a new behavior for kids, as they start to go back to the classroom,
Mhm.
could it go away? Is that what I want to say? I mean, if they get back into that routine of going back into
Right.
class, and
Right.
the same for adults as well, if they get back into the office.
Yep, Ronnie, that's a great question. And what we look at is if it's actual ADHD, it's a neurodevelopmental disorder. So it would not go away. It could maybe subside a little bit with, the correct um, the correct interventions in place, the correct school interventions in place, the correct interventions in place in the workplace. But we wouldn't expect to see it completely resolve. And if it did, and if this is, if pandemic learning is the first time that you've ever heard of any issues with your child or seen, then it's probably not ADHD, and you can just kind of tighten their environment up a little bit and make it better for them. A lot of children are struggling with online learning because it puts a lot more on them, and parents as well.
Yeah, some people learn better online and some people don't. And so before a parent tries to get professional help, is there a test, a self-assessment test that they should be doing, either for themselves or for their kids?
Yeah, so Google and the internet is both a blessing and a curse, right? And with ADHD, it's no different. So you'll Google it, and there's a ton of information out there, and some of it is great, and some of it is not so great. So what I always direct parents and newly diagnosed adults to, or even if they're wondering, is CHADD.org is a good one. That's CHADD. That's children and adults with ADD. CHADD.org is a good one. And then Attitude magazine, that's another good one. And as you're looking at, you can even just Google, diagnostic criteria for ADHD and see, do I meet these symptoms? And we're looking also for, are these symptoms pervasive and are they persistent? Is it, really something that's impacting your work, your functioning in daily life?
So I'm thinking you probably hate it when people say, well, according to Google, this says this, or I was on the internet, right?
Right. Yeah, it's good to do your own research, but just make sure you're looking at good resources.
Right. So is this something that could get worse? So if a child is already maybe being treated, can it get worse? And and what does that look like if that does happen?
Yeah, it can certainly, the presentation can change, right? And oftentimes they'll have to experiment with interventions before they find, what works specifically for their child. So you could see it get worse before it gets better. So you could see maybe an uptick in, a lot of children with ADHD have difficulties with behavior regulation, with emotion regulation. And so when they feel things, they feel them strongly, and they have difficulty with impulse control. So you may see some acting out behaviors. So that's what we really aim to address in treatment, and with just even assessing it in the first place. And for parents to be able to have resources to look at some, manageable strategies when dealing with their children.
I'm just thinking about what it must be like to be a parent right now because, so many people, if they're working from home, but then their kids are having to be a teacher as well and trying to navigate this world and to try to say, okay, when do they need help? When do they, maybe not need help? And it's got to be so hard for everyone right now.
Absolutely. Yeah, it's a lot, but I'm right with you. Parents, especially, they're juggling a lot of balls. So it's, can be really challenging. And especially when you add, a neurodiverse youngster to the picture who, maybe presents with some emotional and behavioral challenges, it just, makes it all the more difficult.
And how about the schedule though? When we're seeing how some of these schools have had to go in person, then remote, and then back in person, and then it's half days, does that help contribute to some of these issues?
Absolutely, because when we're looking at, ADHD or children with emotional or behavioral difficulties, predictability and routine are something that we can usually offer them that helps them to be successful, right? And through, nobody's fault, this predictability and this routine has really been snatched out under them. So that can lead to an increase in symptoms because they don't know what next week is going to bring. Parents don't know what next week is going to bring, as far as what is learning going to look like.
Oh, Dr. Jessica Garrett with us here on the MegaCast. She's with the Birmingham Maple Clinic. With that, what are some of the other services that you and your colleagues treat there at the clinic?
So we see a lot of anxiety, depression, thought disorders, mood disorders. We offer, therapy as well as psychological testing and assessment. We have a couple of psychiatrists on staff who do, medication review and updates. So yeah, we're seeing a lot. We're seeing a lot of different, presentations.
So, with that, if anyone is listening or watching right now, what advice do you have for them?
Yeah. So, advice that I have for them is to, if you think you need help, then it can't hurt to seek out an evaluation. Through the purpose of evaluation, through what I do with psychological assessment, is really try to pinpoint holes, but also look at strengths, right? So, if you do some, Google research and find that, perhaps it's worth looking into this further, an evaluation can be immensely helpful. And then to just tighten up your environment a little as much as you can. And I always tell parents and adults to just be graceful with yourself, right? Don't be too hard on yourself, and allow yourself grace, allow yourself that it's not, all going to be perfect, that there's going to be some missteps, and that's okay.
I think what's been so hard about this is it's been so long.
Yeah.
Because think back to last March, it was like, oh, for 2 weeks, oh, then 2 months, and now we're nearly 11 months into this. So it can get a little bit harder, not just for the kids, but their parents as well, to try to get to struggle with everything that we're going through here in our country and globally as well. With that, your services, is it referral based? How does that work?
Yeah, so our services, we do see people by referral. We see people directly when they contact the clinic. We see, people are sometimes referred by their primary care physician, or, an outside psychiatrist or therapist. And so we, referral wise, we see, either direct referrals, or if they're referred, by someone else.
Dr. Jessica Garrett with us here on the MegaCast. Doctor, before we let you go, anything that I didn't touch on that you want to share with our audience today?
No, I think we touched on it all. I would just like to highlight again, just to, be graceful with yourself and those around you. And, I think we are all struggling at some level. It just varies with all this uncertainty that has happened the past, almost year. So to just, yeah, and then to reach out for help if you need it. There are resources available for you if you need it, for you or your family.
And we have definitely all learned during the pandemic, it's okay to ask for help. And
Absolutely.
hopefully, one of the good things that comes out of this is it's removing the stigma attached with
Mhm.
asking for help. So we so appreciate your time today.
Thank you. Thank you so much for having me.